Hello, everyone, and welcome to this conference press from the Regional Director for Public Health of Montreal, Dr. Mylène Drouin. We are going to be proceeding first of all to a French speech, followed by an English one, and then a question period by the journalists following the press conference over the phone. Important message for the journalists who are present: please do not forget to place your phone on vibrator in order to actually take the sound off so that we don't get any feedback. And you can also go to the CIUS Centre Sud of Montreal, and also anybody who wishes to follow the conference on social media, it is live on the Facebook page of Santé Montréal. Dr. Drouin? So hello, everyone. So it's a pleasure for me today to be able to let you know what the state of the situation is regarding COVID-19 for the region of Montreal. As you heard in the Premier's press conference this morning, for Montreal today we have 603 cases that are confirmed. That represents about 45% of the cases in the entirety of Quebec. We have 40 people who are hospitalized, 7 of them in intensive care, and unfortunately, we must deplore a first death of an elderly person. Right now, we have 2 outbreaks. One is in a CHSLD, counting 5 cases, and 1 in an establishment, a healthcare establishment. We have many healthcare workers who are infected, over 31, which also brings us to make investigations and specific actions to those areas, but we do not have any confirmed outbreaks in those places. Looking at the breakdown of the territories over the Montreal territory, what we can see is that it's a very important concentrations in one of the territories, which is the Centre-Ouest CIUS of Montreal, which has over 42% of all the cases in the region. It is difficult at this stage to find the reasons. Have there been more screenings, more traveling, more people who came back from traveling, snowbirds, for example? Are there any specific groups? Do we have family clusters? But we don't have any outbreak. We cannot, at this stage, identify specific outbreaks to the territory. Over 50% of the present cases are associated to somebody coming back from a trip, and the vast majority of the rest are either contacts of people who had contact with people who traveled, or the people who traveled. In Montreal, we can say that we have community transmission. In many of the stories that we've heard, we've had cases of second or third generation, and many cases for which we simply cannot identify the source. When we look at the description, the profile of the cases, close to 50% of them are people 50 years and over, and 27% over 60 years of age. All age groups are represented, but we have very few cases of people below the age of 18. Most of the cases are in men, 56%, and the most frequent symptoms in 3/4 of cases are coughing, fever, and overwhelming fatigue. 26% of the cases that we have, the people also declare having a chronic illness. As far as the screening, COVID screening clinic, of course, since yesterday, there's you saw that the clinic opened. 3,000 people have been evaluated, and 2,400 people actually had a screening test. What is important to say, what I'd like to add, is that each positive case is being investigated by our teams here at Public Health, and it is important to collaborate. It is part of the strategy in order to diminish the risks and decrease that curve. We must, at each case, identify the source, whether there's an outbreak. Are there any measures to set up in one area or a specific community? So it is important to give us the information to tell us the truth and, of course, help us find contacts that are at risk, because we are also intervening with those people to make sure that they isolate themselves, that they keep an eye on their symptoms to avoid any secondary transmission. Those investigations are at the heart of our intervention. Finally, I would like to reiterate another message linked to travelers. Today and yesterday, once again, there's a lot of travelers coming back to Canada. Just yesterday, we had over 9,000 passengers, international flights or people coming back from the States. Today, it's 4,000. You must isolate yourselves for 14 days. It's important. We cannot allow ourselves of importing new cases to Montreal or the rest of Quebec. Thank you very much for having listened. I will now speak in English.
Hi, so today I will do an update of the Montreal situation. We currently have 603 cases in Montreal. 40 people have been hospitalized, 7 people are in intensive care unit, and we deplore a first death of a senior person. We have actually 2 outbreaks, one of 5 cases in the CHSLD and 1 in another healthcare facilities. We have 31 healthcare workers who are infected, so we have investigations that are being done in the healthcare facility where they work, but we do not have any specific outbreaks at this time. When we look at the island of Montreal, we see that more than 42% of our cases are in one specific territory, that is the CIUS centre-ouest de l'île de Montréal. Nearly half of the cases that we have are travelers, and the balance of the majority of the balance of the cases are contacts of travelers that had symptoms or contacts of cases. But we know that we have community transmission for some cases. We have seen second and third generation transmission, and for many cases we are not able to find a source. When we look at the description of the population that is affected, nearly 50% of the cases are over 50 years old and 27% over 60 years old. Although there is really few cases in children under 18, all age groups are affected. We have 66% of cases that are men's, and the main symptoms that are reported are cough, fever, and fatigue. I want to reinforce a message. Every case is investigated by the public health authorities, and it is important to collaborate. We have done so far more than 600 investigations. Just yesterday was more than 200. And those investigations are crucial in our strategy. We have to identify the source. We have to identify if there is an outbreak, and to see if we have to put an intervention in specific places or in specific groups. We have to, during those investigations, we also try to find the contacts that are most at risk, to make sure that we phone them and give them the recommendation to make sure that we do not generate secondary transmission. At the end, I just want to say that also we still have a lot of travelers coming in. Yesterday it was more than 9,000 travelers coming in at the Montreal airport. Today it's more than 4,000. Please do respect the 14 days of isolation. It is important at this time. We do not have the luxury to add new cases in Montreal. We need you to cooperate. Thank you.
Merci, Dr. Drouin. Nous allons maintenant...
Thank you, Dr. Drouin. We will now go to the question period. We will start with questions in French, followed by questions in English. I would like to repeat the procedure. To journalists, please let us know your presence to the address sent, and you'll be able to ask your questions one after the other. The question: what portrait Dr. Drouin thinks is appropriate in terms of equipment and protection, individual protection measures in the health network? Well, clearly, I think the Premier said so. The organization of services, I think, the entire network is mobilized to prepare hospitals and protective equipment. And what the Premier mentioned to us is that the equipment was going to be available to protect our guardian angels, that is, the healthcare workers. And I reiterate that the action of public health and of my teams is to do things ahead of time. And the importance of the action that we are bringing about in investigating each case is really with an idea of reducing the number of cases and hospitalizations that we will be finding in the next weeks in our hospital. Next question.
Oui, bonjour, Dr. Drouin. Alors, vous avez souligné qu'il y avait donc quand même 42% de tous les cas.
The question is very difficult to hear.
Sur le territoire du centre-ouest. Donc,
something about 42% in Centre-West.
Je voulais voir avec vous si ce sont principalement
is it mainly
centres de personnes âgées, des CHSLDs
and homes for the elderly? Residents for perhaps autonomous people or others? At this stage, Centre-Ouest, first of all, I'd like to correct. The Centre-Ouest is really the territories that are more around Côte-Saint-Luc, Côte-des-Neiges, so it's more the central part. It's not at all West Island. At this stage, knowing that 50% of our cases are still of people who traveled, it is very difficult to be able to have a diagnosis on what the explanation is, why there's so many cases in that territory. Is there more screening going on? Are people in that community, have they traveled more? Did they travel more during spring break? Are there regroupments? Are there communities that were more affected? What we can see is that, yes, there's a few cases, perhaps in a CHSLD, but we don't have any specific outbreak that we can identify right now in that territory. We have family clusters, which is normal because very often if there's a case, it will affect many people within a same family or the proximal environment. But at this stage, with all of the data that we have and that are accessible to us, we have a hard time explaining why there is such a large concentration in that specific territory. Concerning the elderly, Notre-Dame de la Merci CHSLD already has cases. Inaudible. Are there other cases? To my knowledge, the outbreak is at the same number as yesterday, so no, the last cases that added themselves are not CHSLD necessarily. And of course, all the measures have been taken at the CHSLD to isolate and ensure and to put the people who are infected in a safe zone and the contacts of those cases, and have precautionary measures as well for the healthcare workers who are working with those people.
Allez-y, Aaron.
Yes, Dr. Drouin, I have
English?
questions for you. Given that there is now community transmission in Montreal, do you plan to expand the criteria for COVID-19 testing?
Yesterday, the government the criteria for testing is decided by the government. It is not a decision that can be taken at a regional level, and because we have a capacity to test and we have to be coordinated with other regions. Because if I open the valve or to test everyone and I take all the capacity, I think we have to coordinate ourselves with the government. But right now, we have opened some criteria to healthcare workers, people that are hospitalized, and that are hospitalized and that can have a pattern or symptoms that can be like COVID, and of course workers that are les premiers répondants, là. Donc, workers, essential workers.
Okay.
But of course, we want, as soon as the capacity is bigger for testing, we will have to open the screening to the population with symptoms, but that do not have traveled. But yet, we're not still there.
Aaron, deuxième question.
Okay, second question. You were talking about the Central West, which includes Côte Saint-Luc. The mayor of Côte Saint-Luc last week talked about a quarantine. What are your plans for the Central West, given that 40% of all cases are from this area of Montreal?
But at this time, because the populational interventions are quite in all Quebec are quite aggressive. As we say, we have a lockdown since yesterday, and I don't think that at this time there is a necessity to do a specific intervention in a specific neighborhood. What I think should be done, and we should look carefully, is that this population has a lot of elders, and as said the Prime Minister and Dr. Arruda, it is quite important to make sure that those elders are isolated or confined, and that when they go out of their residency, they be accompanied. So it is really important, I think, in this neighborhood to make sure that the recommendations that have been put in place are well respected, and that in worship places of worship, we do not have gatherings. I think the message has been understood, but it has to be reinforced and applied specifically everywhere, but specifically when we see that there are some neighborhoods with more cases.
Question maintenant à Anthony Nerestan de Radio-Canada. Anthony?
Okay, can you hear me?
Yes, we can.
Okay, perfect. Just making sure. Dr. Drouin, I wanted to go back to the homeless man who was let go after testing. What can you tell us about how that was able to happen, him leaving a healthcare facility without any arrangements for self-isolation?
But I think we've managed the situation, and we have now, at the time I'm speaking to you, we have a place that has been identified to make sure that if homeless people are screened and they have to be isolated until they have their result or with symptoms, we have a place where we can isolate them. Of course, last week we presented our strategy for homeless with the Royal Victoria. It's being put in place. I think the sooner it's going to be there, the better it is. And we're also putting in place 35 beds at Notre Dame that are going to be specifically for homeless that need hospitalization. So the strategy is there. I think we had to readjust ourselves because it came earlier than we thought. But now I think for today we have a place and a plan to make sure that if we have an homeless person with a test and we have to isolate him, we have a place where we can place for him.
Deuxième question, Anthony.
My second question and last question, what can you tell us about the seniors' home in the Montreal area that's dealing with the spread in terms of what neighborhood it is, the extent of the spread? Are there any details you can tell us?
At this time, I do not have more details than what I told you. We had one outbreak, one CHSLD that we know we have an outbreak. I don't say there's not other places where we have one cases, but we're not the specific outbreaks. We have one in the north of the island, and the intervention has been put in place by the Prevention Infection Control team, and we're managing this outbreak. But I do not have more information to give on this at this time.
Merci, Anthony. J'ai une question maintenant de la part de Michel.
A question now
de Montreal Gazette.
from Montreal Gazette.
Hello, Dr. Drouin. Can you hear me?
Yes.
Okay. Yesterday, Minister McCann said that there had not yet, to her knowledge, been any healthcare workers that had tested positive, except on the job. In other words, there were 4 who had tested positive, but they had all been traveling. Is that still the case today, or did you say we have some cases of healthcare workers testing positive in Montreal?
I cannot confirm I would have to go see my team to confirm this information. I do not have the information on the spot.
Okay, thank you.
Il nous reste une question de la part de
We have one question left from Radio-Canada. Dr. Drouin, would it be possible to explain concretely the logistics set up to maintain and control the virus in CHSLDs? Well, concretely, of course, when we have one or more cases, obviously the investigation is made as in any other place in order to try to see who has been in contact, whether it be the workers or any other residents, depending on whether the person can leave the room or not. So it's the same principle to identify the contacts that are at risk, who will be isolated. If there are workers, of course, they go home. If it is contacts that are also residents, we find a way of isolating them, depending on the numbers. Of course, that is where sometimes we have to move people in order to protect those who have not been in contact from those who have. Afterward, of course, we take extra precautions that we ask the healthcare workers in terms of personal protection equipment, so masks, gloves, and all that, for the people who will give care to those people. So it really is these measures that are well framed. We tested them out during other outbreaks of the flu, etc. So there's really prevention teams, disinfection teams that do the investigation, that retrace the context, and that set up measures to avoid, of course, any spread. Usually we invite that there not be any visitors, but it's already the case that there are no visitors. So then, of course, there are measures that right now are already set up that help us right off the bat at avoiding the transmission to other residents of the HSLD or the residents. One last question, Michel Lalonde from the Gazette. It will be the last question.
On peut prendre une question en plus de Michel Lalonde. Alors, Michel Lalonde, c'est à vous.
Yes.
English?
I wonder if you could say a few words about the breakdowns that we've seen, selon l'âge, the age breakdown. So we're looking at, 20% of people, for example, in their 50s are testing, of the people testing positive are in their 50s. Can we extrapolate anything from that, from those numbers, or or do we is that just the most people that are being tested are in their 50s? Do you have anything to say about that yet?
I think knowing that the younger you are, the less symptoms you have, that is documented in the literature. Maybe the younger person, adult or children, have not been tested because they do not have a lot of symptoms. So I think and this represents, of course, the population that have decided to go get a test. But we know that people that have a lot of more symptoms, that are hospitalized, are more older. So, of course, they get tested because their symptoms are heavier or more present. But I think we'll be able to interpret more this pattern the more we are going to go in the evolution of the epidemic.
Et une dernière question.
Oui, Catherine Lévesque, donc la presse. Dr. Drouin.
Dr. Drouin, you talked about 42%. But 58% inaudible. Where are those other places? It's pretty much spread out. All other territories have between 12 and 15% of cases, and there's perhaps the downtown area where we're at about 20%. So it's pretty similar, the breakdown on the rest of the island of Montreal. There is really something more going on in the Centre-Ouest territory, and the more we go forward in our investigation, we'll probably manage to understand that phenomena a little better. But as I was telling you, it's perhaps traveling, the snowbirds, the screening tests, or outbreaks that are group or family related. My teams right now are working on that to try to understand and find answers to that question. Thank you. Thank you to the journalists for having been present.
On peut prendre CTV une question et c'est malheureusement tout le temps.
CTV, one last question.
Alors, CTV, allez-y.
Okay, thank you very much. This is Matt Gilmore. Just to sort of circle back to the homeless question for one more second. Some of the shelters are saying that they're at an 11 on 10 alert level. What are you guys doing with the shelters to ensure that they can stay open and function well? They've been asking for potentially to have nurses there, extra equipment. And then when it comes to isolating homeless people, there's a large percentage of that community that is dependent on alcohol or drugs. Is there going to be provisions made for those people so that they're not also dealing with withdrawal symptoms while they're in isolation?
At this time, the CIUS Centre-Sud, the team that's working on homeless people with the City of Montreal, and of course with the shelters, they're working on this strategy, the strategy that we're going to put in place. The first thing that was important to put in place was if we have a symptomatic person that is tested or positive cases, where do we isolate them? And that's what we've been working on last week and now and in the current week. And we've adjusted the strategy because, of course, it came earlier than we thought. And now what we're looking with the shelters is how we can put in place the same distanciation, donc the same strategy of not putting 200 person in the same shelter at the same time. So we're going to look in the next few days how we can make sure that there are not so many concentration, and if the shelter stays open, how we can make sure that they have the equipment to protect themselves and the practices that will prevent cases or transmission. So we're working with them, but we're working with the shelters to make sure that we have the best strategy for this community.
Alors, merci beaucoup. C'est tout le temps qu'on a.
Thank you. That is all the time that we had. Thank you to the journalists who were present. We unfortunately have to put an end to this. Thank you, everyone.
Merci.